Our practice is really different from most other practices because we have subspecialties. In this day and age, there is so much change in healthcare. And our practice is really different from everyone else's because, first of all, we've been in practice as a group since World War II. That's a really long time. And you know that there's a good continuity of care because all of our doctors stay with us. We're all together, and there's always a flow of doctors in, and as they retire, they leave. So there's always good continuity for the patient. You don't have to worry that your doctor will come and the next year he'll be gone. We don't do that. We've been around since World War II, so it's pretty stable. And that's something that counts in this environment, to have some stability with your physician and your physician's group. You can be rest assured to know that we have all your records and we will continue your care for as long as you need it. And that's something very different in our group. The other major part of our group that's really different from everyone else is that we have subspecialists. We have spine doctors and sports doctors, we have hand doctors, joint replacement doctors. We have all sorts of subspecialists, and we're all fellowship trained and board certified. So you know that you're getting the best of the best. So that if you come in, for example, with a shoulder pain, and your shoulder doctor looks at you and says, you know, I think this might be coming from your neck, you then don't have to go out and find a neck specialist because one of his partners is a spine specialist. So you know that you're going to get all of your care in one place. It's kind of like a one-stop shop, but instead of everybody being a little bit knowledgeable, you have each one of us being very knowledgeable in our own fields. So you know you're getting the person with the latest training, the most up-to-date techniques. And because the techniques are up-to-date, that means we can do things like minimally invasive surgery. Now, years ago, we used to make big incisions for all sorts of things. But now, we do very tiny operations, and some things that used to have people be in the hospital for a week, we do as an outpatient. When's the last time you heard of a spine surgery doing an incision about an inch? Pretty small, and it works pretty well. So some of the commercials on TV are actually pretty accurate, but we do those right here, right in this area.
My name is Carl Honetter. I heard about Landmark Orthopedics from a previous patient that is still coming to Landmark Orthopedics. I've been coming to Landmark Orthopedics for about 4 months now. Dr. Blazer is very thorough, explained all the issues of my back. Dr. Blazer offers other options besides surgery and medications for a comfortable life. I would definitely recommend Landmark Orthopedics to my friends and other people because of the great services that I receive here.
Now, I'm a native Rhode Islander, so I know what it's like to go all the way to Providence. There's no reason to go anywhere but in your own backyard, in your neighborhood. So as you can tell, things have really changed. We have all the up-to-date equipment, all the up-to-date techniques, and every doctor you see will be a subspecialist for your particular needs.